Hello, my name is Dr. Tara Baxter, and I'm an orthopedic surgery resident at the University of Toronto, currently in the Clinician Investigator program. As a member of your Paro General Council, I'd like to congratulate you on matching to the residency program of your choice in Ontario. We know that you've invested countless hours of work, blood, sweat, and tears to get this far. Well, hopefully not blood, that's actually an exposure risk. But if you're like me, now that you've finished with your final exams, you're probably thinking, what on earth should I be doing before residency? Studying? Partying? Completely freaking out? There's no need to feel anxious. Here are my 7 recommendations to ease you into it. First, let's just get the boring stuff out of the way. There are many administrative tasks to complete before residency. That's fancy talk for paperwork. Be sure to apply for your CPSO and CMPA. You'll need those numbers before you start working, and the applications can take a while to process. Register as a student with your university and pay your fees. I found it helpful to get my student card early to avoid the long lines that happen later on. Look into your university's requirements regarding immunization and police background checks, because documentation can again be slow. Number 2, re-examine your loan situation. If you have OSAP or another provincial loan, be aware that once you finish medical school, you might be required to begin paying it off. Meet with your financial advisor or bank manager to discuss your options. Number 3, now we can move on to the fun stuff. Whether you're moving to a new city or just need a change of scenery, you can search for a new place to live. I recommend planning to move in on June 1st, which gives you enough time to unpack your books and stethoscopes and get to know your city a little bit. Consider arranging for a local cell phone number, finding a family doctor in the area, and joining a fitness club. Planning to have everything organized and completed before July 1st will considerably reduce your stress levels. Number 4, if you've dreamed of backpacking around Europe for a month, now's the time. The chances of getting 4 weeks off in a row in the next few years are slim, so take the chance to travel now and cross something off your bucket list. Number 5, this is the ideal time to rest and recharge. Catch up with your old friends, check out the nightlife in your new city, hang out on the beach. You're about to embark on a wonderfully rewarding journey, but it can also be exhausting, both mentally and physically. Recharging will relax your body and sharpen your mind before July 1st. Number 6, you'll be pulled in many different directions once you start residency. So spend some of your downtime with your family. You can use this opportunity to enlighten them about the pressures and time demands of your new schedule to help them understand why they might see less of you after July 1st, when your patients began to demand more of your time. Number 7, and this is the biggest conundrum of all. Shouldn't you be spending the summer studying? When I realized that I'd be studying relentlessly for the next 7 years, I decided to take advantage of the leisure time I had before July 1st. But think about what works for you. Some of my friends compromised. They studied X-ray interpretation or USMLE prep next to the pool with a nice umbrella drink in their hand. Along with the entire Paro team, I'd like to wish you a lovely and safe summer, and we can't wait to meet you on July 1st.